Hi, Emma. Could you explain the heart's conduction system?
Of course. The heart's conduction system is crucial for understanding heart rhythm disorders. It's made of specialized myocardium, which is insulated from the rest of the working myocardium. This system is specialized in signal transmission.
How do these cells work?
The cells of the conduction system have the ability for spontaneous diastolic depolarization of their cytoplasmic membranes. This change in the membrane generates an action potential, which spreads from cell to cell at communication contact points. The timing of these electrical activities can be recorded by an electrocardiograph, producing a curve known as an electrocardiogram or ECG.
What influences the speed and frequency of these signals?
The speed of conduction and the frequency of impulses are increased by sympathetic stimulation and decreased by parasympathetic stimulation.
What about the nodes involved in this system?
There are two main nodes. The first is the sinoatrial node, or SA node, which is the primary pacemaker of the heart. It's located at the opening of the superior vena cava on the crista terminalis, a ridge that separates the sinus venosus from the main atrial chamber. This node generates signals at a rate of 60 to 80 impulses per minute, known as the sinus rhythm. The frequency can increase or decrease depending on factors like physical exertion and temperature.
How do the impulses travel from the SA node?
The impulses spread from the SA node to the atrioventricular node, or AV node, primarily through the internodal pathways. These pathways consist of closely packed cardiomyocytes in the right atrium, facilitating the transmission of the impulse between the SA and AV nodes and between the right and left atria.
What is the role of the AV node?
The AV node acts as the secondary pacemaker. It's located at the apex of Koch's triangle, near the opening of the coronary sinus, just below the fossa ovalis. Here, the impulse transmission slows down, with a frequency of 40 to 50 beats per minute. If the primary pacemaker fails, or there's uncoordinated impulse transmission, the AV node takes over, creating a slower rhythm called nodal rhythm.
What happens next in the conduction pathway?
From the AV node, the signal moves to the atrioventricular bundle, also known as the His bundle. This bundle passes through the right fibrous triangle of the heart skeleton, splitting into the right and left bundle branches, or Tawara branches. The right bundle branch is a direct continuation of the His bundle, consisting of working myocardial cells and fewer Purkinje fibers, while the left branch forms a fan-like structure composed mainly of Purkinje fibers.
Can you tell me more about Purkinje fibers?
Purkinje fibers run subendocardially within the muscle layer just beneath the endocardium. Jan Purkine discovered this conduction system. These fibers ensure synchronized contraction of the myocardial cells by transmitting impulses efficiently. The conduction system is designed for one-way signal transmission due to the connective tissue surrounding the fibers, providing insulation from the rest of the myocardium.
How do nerves influence heart function?
The heart is innervated by the autonomic nervous system, but it can function independently due to the myocardium's inherent activity. Parasympathetic activity decreases heart rate and contraction strength, causing coronary artery constriction. Signals are transmitted to the heart via the vagus nerve, with branches running along the carotid artery to the aortic arch. Excessive vagus nerve stimulation, especially in individuals with narrowed coronary arteries, can lead to vagal death.
And the sympathetic nervous system?
The sympathetic nervous system increases heart rate and contraction strength, dilating coronary arteries through circular muscle fibers. There are 3 levels of cardiac nerves: superior cardiac nerve from the superior cervical ganglion, middle cardiac nerve from the middle cervical ganglion, and inferior cardiac nerve from the cervicothoracic ganglion, stellate ganglion. Pain from myocardial ischemia is often referred to the T1, T4 dermatomes, causing pain on the ulnar side of the forearm and hand.
What about the pericardium?
The pericardium receives innervation from the phrenic nerve, which runs anterior to the lung hilum. Its main root supply is from C4, which can cause pain that radiates to the lower extremity.
Thank you for the detailed explanation.
You're welcome. Understanding the heart's conduction system is fundamental in diagnosing and managing cardiac conditions.